you okay, sweetie?
Don't touch me.
Are you serious?
Yeah.
Don't talk to your mother like that. Are you kidding me?
Wait, you're touching me.
You never act
Hey,
like
Miss
this.
Bailey. I'm Nurse Jonathan. I'll be your nurse for today. Could you verify for me your name and date of birth, please?
Bailey Beast 1185.
Okay, awesome. So, I read the report, and you've had surgery last week, and you're in here with some issues related to that. Do you have any specific issues you want to talk about today?
I've been having leg cramps, and my foot's also been cramping. And then I feel like my heart's been fluttering, and I get kind of dizzy sometimes.
Okay. Have you experienced any hair loss or any sort of thing, like while you're showering you tend to shed more hair than you do normally?
I'll grab clumps of hair,
Oh man.
and
Okay.
it's just happened within the last
She's
week.
also been like really rude recently. Not sure what's going on after her. After
Is
that
she-
thyroid surgery, she's been going downhill.
She's not normally like that then?
No, she's usually a sweetheart, but lately, just so rude.
Okay. So have you had any, do you have any teeth sensitivity or sensitivity to cold when you're
yeah.
drinking or drinking
Whenever-
water or anything?
Whenever I eat ice cream, it hurts really, really bad.
How
and
about when you
then-
like brush your teeth or anything like that as well?
Yeah, and my lips have been really numb and tingly, and
Okay.
sometimes I can't feel them.
Okay. Alright, well I'm gonna get another nurse to come in here and check with you, and I'll be back.
Thank you.
Thank you.
Hi, Miss Bailey. I'm Bowl. I'm going to be your secondary nurse. I'm helping Jonathan out. He's got a lot of patients today. So I'm just going to get some vital signs, just your blood pressure and your heart rate and everything like that. And then I'm going to check for certain signs and symptoms of what we suspect is going on with you. So,
Is it gonna hurt?
no, it won't hurt at all.
Okay.
It's kind of a painless little thing.
She really doesn't like needles, so
Okay,
don't
there's no needles involved, ma'am.
use any of that.
There are no needles involved, I assure you. So, have you been having any brittleness in your fingernails? Have you been breaking fingernails a lot lately?
Yeah, they've actually been breaking super easily.
Okay, cool. I'm gonna check you out. I'm just gonna listen to you on here. You just relax, and I'm gonna get your blood pressure. Okay.
Why is her hand doing that?
Well, that's for something called Trousseau's sign, and that just basically alerts us that she's low in calcium. And we'll have your doctor explain what that really means. But can you just lean your head back for me? And just relax?
What are you doing?
I promise it won't hurt or anything. So I'm just gonna tap on your cheek. Okay.
Okay.
Okay. Cool. Let me look at your fingernails really quick. Okay.
Is he making you uncomfortable?
Yeah, very uncomfortable. That's why I can't help but laugh.
Got some edema in the legs. Okay, I have what I need. And
What is edema?
edema? It's
you're
swelling
so
of the lower legs.
Daughter.
It's swelling in your legs. Alright, I'm gonna go report this to your doctor. I'll be back in a second, y'all.
Hi, how are you?
Good, how are
I'm
you?
Dr. Fenster. Nice to meet you.
It's Baron. I'm her
Nice to
mother.
meet you. All right, so we got your blood test back. Your PTH was low, your calcium was low, your phosphorus was high, but everything else like magnesium, albumin, and vitamin D were normal. So for right now, for your treatment, when you go home, we're gonna prescribe you calcium, and that's gonna help with your tetany. It's gonna maintain normal levels and prevent long-term complications.
I'm sorry, what is tetany?
It's just like the movement in her hand that she's having.
So like
right
when
now.
she's cramping, like it'll help
Mhm.
with that. Okay.
Okay. And then we're also gonna prescribe you vitamin D, and that's just gonna help increase your calcium absorption. And then we're also gonna give you Natpara, and that's gonna raise PTH levels. And then I'm gonna have the nurse come in here and explain everything for you
Okay.
and what you should do when you go home. Okay?
All right.
Any questions?
No, as long as the nurse is explaining something.
Okay. All right.
Thank you.
Nice to meet you.
Thank you so much.
Hey Miss Bailey, so the doctor was here earlier and she gave you a bunch of lab values, and she asked me to come in here and explain some patient teaching with you, or with both of you. And so basically,
Sorry, I don't know why she's being like that.
She's been a bit off.
She's just been a bit off lately.
Oh, okay.
It's honestly embarrassing.
Well, it's okay. So when you go back home, we'll want you to be going outside and getting in the sun. So is there anything in particular you like to do outside?
I like to garden a lot.
Okay. So when you're gardening in the backyard or wherever you're gardening, make sure you're getting into the sun because sometimes it might be shady in the backyard or there might be a lot of trees. So as long as you're getting into the sun, that's important, not just outside.
So what does that help with?
That increases her vitamin D production, which helps with the absorption of calcium.
Okay.
And speaking of calcium, we want you to start eating some more calcium dense foods or foods that are high in calcium, such as any dairy products, so milk, yogurt, cheese, and along with that, if you don't particularly like dairy, you can have kale and broccoli as well, and any of those foods should be fine for that. And for your cramps, you can do what's called rebreathing, and that involves just taking a paper bag whenever you're feeling like you're having a lot of cramps that day, or if you're just cramping up, and you start breathing into that bag, and that'll cause you to just recirculate CO2 back into your system, and that should help with the symptoms that you're experiencing right now.
Okay.
So, yep. Do you guys have any more questions?
Will you be putting her in a home?
No, we won't be. She should be out either today or tomorrow.
So
she won't be
don't
here for
think
too
you
long.
could, like, put her in a home or
I'm
something?
only 35. My mom's just a little delusional.
Oh yeah.
Yeah.
Oh.
Okay.
Yeah, she won't be put in a home, and she should be out today or tomorrow. She won't be here for too much longer.
Okay. Whatever you
Okay.
think is best.
All right. Let me know if you have any questions. Have a nice day.
Thank you.